necessarily brief. Let me start off by saying that I think what you all are about is incredibly exciting. You know, they talk about Moore's Law when they talk about computing and the rest. You guys are sort of the Moore's Law of medicine. I'm looking forward to reading about some of you. Mostly all of you are very young. Every woman here is very young. I don't see an old woman. I see a couple of men. But all kidding aside, you know, the technologies represented in this room are going to help people get healthy. They're going to help them stay healthy. They're going to monitor their health. They're going to receive the best treatment. And if they face serious health challenges. And so it's with similar goals in mind that we embarked on the Cancer Moonshot. What happens, and you've all been through it, many of you have either had family members who have had diagnosed with cancer or died from cancer. Some of you may be fighting it right now. And you all know you do the same thing, no matter who you are, no matter what your position is. When someone you love, when someone you adore has a serious problem, no matter what the problem is, you try to learn everything you can about the problem in order to be able to attempt to have some impact on helping that person that you care so much about. When our son and Howard's great friend was diagnosed after he came back as a decorated war veteran and Attorney General of the state of Delaware and the overwhelming favorite to be the next governor of the state of Delaware, when he was diagnosed with stage 4 glioblastoma, we all knew that it was the equivalent of a death sentence today. And so I set out to learn everything I could about the disease, and it was a foray into an area that I had not spent a lot of time before. And I concluded after this process went on for almost a year and a half, in this valiant fight that he put up, but I learned an awful lot. The most important thing I learned is that you all have reached in research and medicine and science an inflection point in the fight against cancer. I didn't realize that 6 years ago immunology was considered a voodoo science. I'm not exaggerating greatly. I'm being literal. There was one overarching template for how to deal with cancer since the 19th century. You find the tumor, you excise it, you use radiation to kill what's left of it, and you use chemotherapy, and in the process you kill an awful lot of healthy tissue, and you do a lot of damage necessarily, no matter how precise you attempt to be. And so I found myself realizing that maybe, although we couldn't save our son, maybe we could, with a lot of focus, maybe we could save an awful lot of other sons and daughters from this fate. We know that if we don't make significant breakthroughs by 2022, there will be over 24 million people contracting cancer around the world. It's 16 million now. It's an exponential increase. There's a whole range of things I could talk to you about that I don't have time to, from the environment, the lifestyles, which can change that overnight, eliminate 50% of the cancers. But the point is that I spontaneously, when I announced I wasn't going to seek the nomination for president, and walked in the Rose Garden with the president and Jill, my wife, and I said, and it wasn't even scripted, just an outline. I said, the one regret I have, because I knew the press would ask me, are there any regrets? And I said, the one regret I have is I'm not going to be the president who gets to preside over the demise of cancer. Because I believe we are at that point, if we're smart, if we organize the way we conduct this battle. You know, President Nixon declared war on cancer in 1971, and he meant it. He was convicted in his announcement that he would, in fact, bring the war to cancer. But the problem was, he had no troops, he had no army, he had no resources, and he had no clear strategy how to win. After 45 years of progress and dedicated research funding and training scientists and physicians, treating millions of patients, and powerful new technologies and tools, and with the Moonshot, we have an opportunity to lay out a clear and specific strategy for the road ahead to make 10 years of progress in the next 5 years. But as I said, we're at this inflection point, and we can save millions of lives by progressing faster. There is, I think, the two most important things about the moonshot are, one, my absolute conviction that we have to inject an overwhelming sense of urgency into this fight. You know, if those of you are docs in here or oncologists, you know how many times you had a patient say, not save me, doctor, but give me 2 more months so I can walk her down the aisle. Just give me 2 more months. I don't expect you to save me. Let me be around for another 3 weeks, doc. I want to see my granddaughter born. Just give me a chance, doc. Just give me another 2 months. I can get my finances right so when I die, I'm not going to leave chaos behind. I've met with over 9,000 researchers in this area. 9,000. They're the most dedicated people in the world. They're not clinicians, they're in a laboratory. They're working around the clock. On weekends, they don't hear that plea. There's not the same sense of urgency. The second thing is that what I'm trying to do with the moonshot is not only create a sense of urgency, but begin to change the culture of medicine. You all don't play well in the sandbox. If you seek a grant as an astrophysicist to study the 7th ring of Saturn, you have to publish your results, fail or succeed, immediately upon finishing your research. You get the same amount of money to study proteins on cancer cells. You have a year. You don't have to disclose everything. It's done behind publications that cost $150,000, $125,000 a year to subscribe to. And over 60% of you don't even file the reports. And